What are device-based therapies for resistant hypertension? Have you ever wondered how some people struggle with high blood pressure even after trying multiple medications? This condition is known as resistant hypertension. It occurs when blood pressure remains high despite the use of at least 3 different classes of antihypertensive medications, including a diuretic, or when it stays uncontrolled even with 5 or more medications. Let's take a closer look at device-based therapies that can help manage this challenging condition. One of the main approaches is renal denervation. This is a catheter-based procedure that targets the nerves in the renal arteries. These nerves can increase blood pressure by raising renin levels, causing sodium retention and higher vascular resistance. There are 2 main types of renal denervation: ultrasound-based and radiofrequency-based. Both methods are minimally invasive and aim to reduce nerve activity, which can lead to lower blood pressure. Another interesting therapy is Baroreflex activation therapy. This method involves stimulating the carotid sinus baroreceptors, which are sensors that help regulate blood pressure. By activating these sensors, the therapy reduces sympathetic nervous system activity, leading to a decrease in heart rate and blood pressure. Devices like the Baroreflex Neo are specifically designed for this purpose. While some studies show promising results, there are still challenges related to safety and efficacy that affect regulatory approval. Endovascular baroreflex amplification is another technique that uses an implantable device to enhance the body's natural blood pressure-lowering reflexes. This method mechanically amplifies signals from the carotid artery, helping to regulate blood pressure more effectively. Carotid body ablation is also an option. The carotid body senses blood oxygen levels and can influence sympathetic activity. By removing or ablation of this tissue, it is possible to reduce sympathetic drive and lower blood pressure. Lastly, there is the creation of an arteriovenous fistula. This less common approach connects an artery and a vein to reduce vascular resistance, which can also help lower blood pressure. These device-based therapies are generally used alongside medications and lifestyle changes, especially for those who do not achieve adequate blood pressure control with drugs alone or have trouble sticking to their medication regimen. Over the past 2 decades, clinical trials have helped identify which patients may benefit most from these therapies and have improved the safety and effectiveness of the devices. In practice, these therapies offer an alternative way to manage resistant hypertension by targeting the nervous system pathways involved in blood pressure regulation. This approach can potentially reduce the risk of cardiovascular complications that come with uncontrolled hypertension. However, it is essential to consider patient selection, device choice, and long-term outcomes when using these therapies.